Okay, so let's continue our lecture slide on the topic of embolism. So embolus is any detached, traveling intravascular mass which is carried by circulation and is capable of clogging the arterial capillary beds at a site distant from its point of origin. So we could see that in the picture in this slide number 24, there's in the blood vessel there's already a blood clot, which is the thrombus product going on, and embolus is actually fragment of the thrombus or fragment of the blood clot traveling through the vein. So embolus, so that's why it says that embolus is any detached traveling intravascular mass which is carried by circulation, and it's capable, it can clog the arterial capillary beds. So it's quite dangerous because anything that blocks, it means that it will cause obstruction. So embolism is the occlusion or obstruction of a vessel by an abnormal mass, which is the embolus. Okay, and it's transported from a different site by the circulation. So most emboli, most of the emboli products, they are actually detached fragments of the thrombi. It's actually detached fragments of the thrombus. The thrombus product, the thrombi, we can call thrombus or thrombi, that under the topic of thrombosis. So embolism is the detached product of the thrombus that that are carried in the bloodstream. Okay, so that's we call as emboli or embolus. It's just the same. Emboli, embolus, thrombus, thrombi, same. So emboli is usually the detached fragments of a thrombi. So embolism, it means there's an obstruction going on, obstruction of a vessel that is caused by this embolus. Okay, so in this picture we could see embolism. It means there's embolus that moves through the bloodstream. Okay, and then as embolus moves through the bloodstream, okay, when it comes to when the vessel, the bloodstream, when the vessel, the blood vessel becomes narrow, so this embolus will then block the blood flow in the vessel. So when it blocks, it will cause obstruction, and we call it embolism. So in slide number 26, there's the origin of embolism. So embolism, it origin in the systemic veins, and it also origin in the heart and systemic arteries. So origin in systemic veins, it originate from the systemic veins, which is as a result of the venous thrombosis, or number two, it originates in the right side of the heart. The emboli, it can lodge in the pulmonary arterial system. Okay, unless the emboli, they are in small size, they can pass through the pulmonary capillaries across the defect cardiac interarterial or intraventricular septum, and then they lodge in the systemic arteries, which is called the paradoxic embolism. So emboli, they come in different sizes. They can come in large size, medium size, or small size. So if the emboli, they are small size, they will be transported in the circulatory system from one side to another side, through the blood vessel. Okay, it will just cross over, and sometimes it will stop at a part when the vessel becomes narrow. It will, and that is when it causes the obstruction of the blood flow. Okay, so when the emboli block or causes the obstruction of blood flow, then that's the area where we call embolism. So emboli, it also origin in the heart and also the systemic arteries, where it can originate from the left side of the heart or in the systemic arteries. It occurs as the result of cardiac or arterial thrombosis, like I mentioned before. Emboli or embolus is the product of detached thrombus product, which is the thrombus is the product of a blood clot. Okay, so emboli is the detached thrombi product. So this emboli can originate in the heart and systemic arteries, and it occurs as a result because there's the cardiac or arterial thrombosis going on. Okay, and then this emboli, it will circulate in the circulatory system, and it can lodge in a distal systemic artery such as the brain, heart, kidney, and also intestine. So there's thromboembolism. We call thromboembolism. So one of the example for thromboembolism is the pulmonary embolism. Okay. So pulmonary embolism, it is common in the following conditions, where it is immediate in post-operative period. It means 30 to 50% of patients will have this pulmonary embolism after major operation. It's an immediate postpartum period, lengthy immobilization, oral contraceptives, or also in cardiac failure. Okay, so this pulmonary embolism is common in these following conditions. Okay, so about the clinical effects, it happens depend on the size of the embolus, whether the emboli is big, large, massive, or it's just medium size, or maybe just a small size of the emboli. Okay, so I mean, the clinical effects depends on the size of the emboli going through the vessel. So after this, we see what's the massive emboli, medium-sized emboli, and also the small emboli. So massive emboli is large emboli. I mean, it is several centimeters long, of the same diameter as the femoral vein. I mean, if this massive emboli, it causes circulatory obstruction, it can lead to sudden death. Okay, because the emboli is so massive, so when it obstructs the circulatory system, it can just lead to sudden death, because blood cannot flow through the circulatory system anymore. So this massive emboli, it can lodge at the large branch of a pulmonary artery. It can cause sudden death, probably as a result of severe vasoconstriction of the entire pulmonary arterial circulation induced by the lodgement of the embolus. And then we have medium-sized emboli. Usually medium-sized, they are moderate-sized of emboli, and they often lodge in the major branch of the pulmonary artery. Okay, now the function of the pulmonary artery is mainly for the gas exchange. So therefore, a moderate-sized pulmonary embolus, it creates an area of lung that is ventilated but not perfused. Okay, and this can result in abnormal gas exchange, and it can cause hypoxemia. Okay, if we have a medium-sized emboli in the pulmonary artery. Okay, and last but not least is a small emboli, which is emboli in a small size, and it lodges in the minor branches of the pulmonary artery with no immediate effect. Okay, so in many instances, these small size emboli, they usually either they fragment soon, or maybe they will dissolve. But if there are numerous small emboli that occurs over a long period, I mean, there's lots of small emboli, the pulmonary microcirculation may be compromised, and it may cause pulmonary hypertension. It may result in pulmonary hypertension. if there's lots of the small size emboli that occurs, you know, over a long period of time. So we could see here in slide number 32, there's a picture of the lungs. So we could see that there's pulmonary embolism in the main pulmonary artery, and so we could see that there's pulmonary emboli in main branches of the pulmonary arteries, and we could see that there's multiple emboli in small branches. I mean, when there's multiple emboli in the small branches of the pulmonary artery, it could be that they are the small sized emboli. And the pulmonary emboli, it could be the medium sized emboli. And the pulmonary embolism in the main pulmonary artery, it could be the large size emboli. So this is just an example to show that the large size, the medium size, and the small size. So this emboli could then cause embolism, okay, and it could disturb the circulatory system, as embolism causes obstruction to the blood flow in the vessel. Okay, so that's about embolism. Now we continue on ischemia. So what is ischemia? Okay. So ischemia is a reduction of loss of blood supply in a tissue due to impeded arterial flow or reduced venous drainage. Now ischemia, it causes shortage of oxygen and glucose needed for the cellular metabolism. So ischemia can result in cell loss and also atrophy to the tissue. So in slide number 34, we could see on ischemia, there's a picture. Okay, there's a picture here of a leg. Okay. So when ischemia occurs to a person, we could see that on the leg of a person there's some purplish yellowish color of the skin, you know, we could see some redness going on. So this is the effect on that leg, shows the effect of the ischemia, where it shows that there's a reduction of loss of the blood supply, okay, and showing that there's shortage of oxygen going to the cell, and it causes atrophy to the tissue. Okay, so then it will causes these sign and symptoms on the skin of the leg. Okay, so there are two causes of tissue ischemia, which is the arterial obstruction and also the venous obstruction. For arterial obstruction, there's atherosclerosis going on, which is atherosclerosis is the deposition of lipid with accompanying fibrosis, and it is the major cause of arterial disease. And thrombosis that occurs in the atherosclerotic arteries is the most common cause for arterial obstruction. Like we learned before under the topic of thrombosis, where if there's a thrombus product, in the vessel, it can cause obstruction of the blood flow, and also cause obstruction to the circulatory system. So if there's thrombosis in the atherosclerotic arteries, it's the common cause for the arterial obstruction. So in this picture, we could see on slide number 35, we could see that there's a normal artery here. Okay, so there's artery wall, there's normal artery, it means that there's a normal blood flow going on. And then there's A for normal artery, and then there's B for the narrowing of artery. So it means that the artery becomes narrow, which is not normal, it means abnormal. Because why? Because there's abnormal of blood flow, because there's plaque going on. Okay, so it means that there's narrowing of the artery, it means that there's the obstruction of the artery. Okay, so this plaque could be the results of a thrombus product in the artery. Okay, so narrowing of the artery means that there's arterial obstruction going on. Okay, so the next one is venous obstruction. Venous obstruction, it means that the veins become obstructed, but when veins become obstructed, it causes less clinical problem. Because why? because there's a greater availability of collateral vessels in the venous system itself. So ada banyak veins actually. So bila ada veins yang become obstructed, it causes less clinical problem because in our human body system, kita punya circulatory system, we have lots of veins. We have a big venous system. Okay, so there are few types of ischemia. The first one is brain ischemia. For brain ischemia, it can be acute or chronic. Acute means it's rapid, and chronic means it's a long-lasting. So for acute ischemia stroke, we call it may be reversible if it is treated quickly. Okay, but for chronic ischemia of the brain, it may result in a form of dementia. Okay, called vascular dementia. So for chronic ischemia of the brain, it can result in memory loss lah, dementia, because dementia ni kan dia memory loss kan. So it can cause memory loss lah, dementia. So there's a picture on this slide where it's the ischemic stroke. And ischemic stroke occurs when oxygen-rich blood flow to the brain is restricted by a blood clot or maybe any other blockage. So it can be restricted by a thrombus product or maybe by an embolus product. Okay. So when the blood flow is obstructed, it can cause ischemic stroke. So we could see there's a blood clot in the middle of cerebral artery and there's blockage in the internal carotid artery. Okay, the second type of ischemia is called cardiac ischemia. Now, cardiac ischemia, they may be asymptomatic. It means that they do not give symptoms that the cardiac ischemia is going to happen. So, they're asymptomatic, tak ada symptoms kan? Dia tak ada symptoms. Or they may cause chest pain, angina pectoris. Usually, people yang nak sakit angina pectoris, chest pain ni, kadang dia rasa sakit kat bahu dulu. Dia sakit dekat shoulder, they have pain in the shoulder and then they will feel the pain in their chest. Okay, so cardiac ischemia ni usually it results from atherosclerosis, which is the long-term accumulation of cholesterol-rich plaques in the coronary arteries. So itu ada cardiac ischemia. So ada gambar sebelah ni, salah satu cardiac ischemia is myocardial ischemia lah. So kita tengok dalam heart ni kita ada banyak coronary artery kan, lots of coronary arteries. And then when there's any formation of plaque, it could be the thrombi, the emboli, which causes the blockage or obstruction of blood flow. Dia boleh menyebabkan lah cardiac ischemia kan, ischemia. Cardiac ni maksudnya ischemia that happens in the heart. Kita panggil cardiac ischemia. And then there's bowel. Maknanya bowel usus. Maksudnya both large dengan small bowel ni, they can be affected by ischemia. Okay. Kan kita ada large dan small bowel kan. So they can be affected by ischemia. So kalau ischemia dekat large intestine tu, dia boleh lead to inflammatory process yang kita panggil sebagai ischemic colitis. So in this slide, you can see ischemic colitis, maknanya ada inflammation lah, ada berlakunya inflammation dekat large intestine. So when there's an inflammation kat large intestine, we call it as ischemic colitis. So maknanya ischemia ni, it can lead to inflammation lah, inflammatory process. So that's all for lecture untuk circulatory disturbances 1. Thank you, that's all. For circulatory disturbances 1. So next, so untuk circulatory disturbances 1, there are hyperemia, thrombosis, embolism dengan ischemia. So next I will continue with circulatory disturbances 2 in the next video. Okay, thank you everyone.